So everything went really well, and there shouldn't be any problems at all. We have post-op instructions that I think that you already have a copy of that. And I'm just going to quickly review the post-op instructions with you. Basically, he should just relax today, so he'll be, if you put him in bed when you get home, he's going to fall asleep, I'm sure. And during that time, there may be some bleeding, so expect to see some blood on the outside of the mouth. You can just use a wet washcloth and clean that away. The gauze that's in his mouth now, I would recommend removing that when you get home, so we don't want him to sleep with that gauze in his mouth. And when he wakes up, he can start to have some nutrition, usually things like Jamba Juice or soft foods today, and then after 24 hours tomorrow, whatever he feels like eating. He's not gonna,
cold or fluid or?
I don't think it makes much difference on the temperature,
Oh, okay.
as long as you could eat it, because he's numb, he won't be able to feel anything. And the numbness is going to last about 10 hours, because I used a very long-acting anesthetic, and when you use it with the IV, it makes it last a long time. So he's going to be comfortable for at least 10 hours. Later on, though, tonight, when the anesthesia wears off, it's going to be uncomfortable. So as far as what to expect, usually most of the patients for a procedure like this, if 10 was the worst you could imagine, it would be like a 4. So expect it to be somewhat discomfort, but it's going to get better rapidly, and tomorrow it'll be a 3, the next day should be a 2, and you should see a progression of it getting better every day. And we gave him some medication, so he's going to take the amoxicillin, for infection, and then ibuprofen. Both of those are taken by the clock, so it's not as needed, but it's like 3 times a day, every day when he wakes up, when he goes to bed, and then halfway in the middle until it's all gone, which is 5 days. So I think that's about it. I don't think he's going to get much swelling on this because these teeth were impacted, but they were not deeply impacted, and I didn't have to use the drill or remove any bone or anything. So I think he's probably will get no swelling at all. Brushing, you can start brushing tomorrow. You're going to be just brushing gently in the front of your mouth. It's going to be tender, so you won't want to go way back there near the surgical side. But you can brush tomorrow, and everything after 24 hours. The first 24, you want to be really careful. So the first 24 hours, you don't want to be looking inside your mouth or, chewing food or brushing your teeth or putting your hands in there. Just leave it alone as much as you can, and just remove the gauze, and then, you can have some soft food or liquids today. And just hang out today, watch TV. You can get on the computer. I don't recommend going out and walking around much because the medication stays in your body for 24 hours. Even if you feel normal, you're not going to be completely normal. So today, you just stay home.
And avoid talking.
That's a good point, yes. Yeah, if you talk a lot, it makes it bleed more. So try to just kind of stay quiet, and you can text message or write notes, at least for the first 3 or 4 hours.
Tomorrow she should skip school or?
Oh, no, not for one like this. Yeah, he can definitely go to school. And like I said, I doubt if he's even going to have swelling. And even when there is swelling, they can go to school because it's just cosmetic, and they can still attend school.
And then tomorrow continue with the fluid diet?
No, tomorrow it's back to a normal diet. Whatever he feels like eating, but he won't feel like eating really hard stuff yet. But he'll just, whatever he feels like eating that tomorrow is fine. It's the first 24 hours is the most important part of wound healing. So.
And avoid straw.
Yep, you don't want to drink through a straw, and you don't want to spit because it changes the pressure in the mouth, and that can make it start to bleed again.
Okay.
Good questions. So that's it. Time to go home. Okay.